Well, I think healthcare providers today are in a quandary. There are a lot of items coming at them in a very quick way, and a lot of decisions that have to be made because most of them waited to make a decision because they weren't quite sure that they were going to be that healthcare change was going to occur. And so, but on the same breadth, the reimbursement system that we have today was not going to be sustainable. And those changes had to occur, whether they occurred through Obamacare, whether they occurred through just dissatisfaction within the market, they were going to occur. And so today, what we're seeing is decision making at a very rapid but slow pace because there's so many things to decide. What we've done with the Advanced Plan for Health is that we've been in business now for almost 9 years. And one of the things that we're watching in the marketplace is that there are a lot of folks that are proponents of building structure, but no process. And without the process, the structure is meaningless. And without being able to, well, actually, structure follows process. So if you build the process, the structure will follow and it will gain on itself. I think there's 3 or 4 different things that folks ought to be looking at today as the model changes. One is population health, which is data-driven and moving in the patient-centric way. The second piece of that, and as you identify the data, you identify the individuals, you move to a volume versus value statement. You're now into bringing the consumer and engaging the consumer. And the consumer is not only the buyer, which is the industry or the employer or the government. The consumer is the individual that's utilizing the services because they're just as much buyer today as the employer is, be it with their deductibles and copays and their upfront costs. So basically, the third thing is moving into a different model of managing behavior. So now you have providers interested in patient-centric models, value versus volume, consumers more interested in transparency and impact, and moving the 10 or 20% of the population that spends 80% of the bill. Fourth thing is that, in my opinion, the payers are going to blend and morph into providers. And so they're going to be one, payer, provider. And what the healthcare industry is doing today is not moving into that. They're staying as a commodity. So if they're going to be successful, they're going to be financially viable, providers have to move into the payer space. And right now, we're just letting the payers move into the provider space. Those are the 4 elements that I see in my crystal ball.
Okay. What are some of the key takeaways from your presentation today? Is there anything from those that you would share?
I just gave you the majority
Okay,
of them.
well.
No, here's the thing that I think providers are in jeopardy of. You know, we've got a system that's changing dramatically. The federal government has imposed a lot of new benefits that are mandated. Those benefits cost dollars. One of the benefits and one of the things that most folks don't understand is that the federal government has mandated that there is no underwriting for groups under 50. And so you're looking at 30% of your commercial business as a provider that the insurance companies are saying, I have to give mental health parity, I have to keep ages up to the age of 26, provide services, no lifetime benefits, and now I can't underwrite that group. And so, quite frankly, I'm going to increase the premium to the point that they have to move into an exchange. And so I have 30 million people now coming into the exchange. The projection is that those folks are going to use benefits at a rate of 112% of a card user today. So I'm simply meaning that if you have an insurance card, the person that doesn't have one and will have one tomorrow is going to use benefits at a rate 112% greater than you. That's 30 million people. Insurance companies are asking for a 10 to 40% discount, and 30% of your population is going into that exchange. Now, point is that how financially successful are you going to be on the fee-for-service basis in that environment? That's connecting the dots. And most healthcare providers don't want to connect those dots.
But is there anything that's not being talked about, like that you're seeing that's coming ahead that people just aren't quite there yet on?
Well, I don't know that my crystal ball's any better than anyone else's. I have a propensity for connecting the dots. And I really, truly believe what we're looking at is probably a two-tiered system, which includes a morphed payer-provider capability. Providers more focused on the retail side of the business and not being a commodity. And then the mass that's going to be in the public exchanges. And you're going to find 30 million people plus movement of the commercial business into that space, a greater level of Medicaid in that space, and limited number of providers. And so, I mean, just take, for example, the state of Texas as a good point. If you present at an emergency room, you have to be treated. You know, whether or not that individual's in the exchange or not. So we're talking about a narrow network, an extremely narrow network that is going to be, that has no capacity. So where does the future? Again, I think we're being moved into a single payer system for a large portion of the population, and a secondary system that's built on this morphed insurance provider capability.